I'm Stephanie Toth-Manikowski. I'm a nephrologist at the University of Illinois at Chicago. I'm a physician scientist as well, and I was a recent recipient of the NKFI Young Investigator Award. The research I do has a lot of different focuses. Over the past few years, I've focused a little bit on access to healthcare and how that affects patients with chronic kidney disease. Through the research, the Young Investigator Award that I got through the National Kidney Foundation of Illinois, I had the opportunity to look at a topic that I actually never thought I'd be asking, which was how sleep affects outcomes in patients with chronic kidney disease. So one of the projects that we're currently working on is looking at these surveys that were done back in 2005 and 2008 and seeing how many of those people, based on the questions that they answered about their sleep, how many ended up progressing to end-stage kidney disease, right? And the hypothesis that we had going into this project was, if our sleep isn't as good, if we have insomnia, if we're not sleeping as much, or maybe if we have more fragmented sleep, maybe our bodies won't be as healthy, and that will lend itself to faster progression to end-stage kidney disease. Those results are still pending, but it's really exciting work that I never really thought I'd have the opportunity to ask if it wasn't for the NKFI award that I got. The NKFI research funding has meant a tremendous amount. As I alluded to before, it gave me the opportunity to do my first pilot study, which I don't think I would have had the opportunity to do to date if it hadn't been for that. It's given us a lot of data in the realm of sleep and chronic kidney disease, and I think that's going to provide the data we need to then move beyond the project that we proposed for the NKFI Investigator Award that I received. So that's really exciting because I think it opens the doors for more research in this field, which is really important to our patients. Research funding is important for kidney disease for so many reasons. One, I'm a nephrologist and I care so much about chronic kidney disease, preventing progression of chronic kidney disease. And I think, like with so many other disorders, the only way to further a lot of the research that myself and other investigators are doing is through funding. Without funding, a lot of projects would be dead in the water. 750,000 people in the United States with end-stage kidney disease, right? 30 million people or so a few years back with chronic kidney disease. And we know that with the exception of a few instances, chronic kidney disease worsens over the course of somebody's life, right? And so if we can figure out ways to slow the progression of chronic kidney disease, help the people with chronic kidney disease improve their health-related quality of life, I think that's worth funding. That's a tough question. Why should we support chronic kidney disease? As a nephrologist, I think it's an easy answer. Because the people we deal with, it's a really tough disease. There was a study that came out a few years back that showed that nephrologists, people who take care of primarily people with chronic kidney disease, actually take care of the sickest patients among 12 other specialties. On average, the number of medications that a patient with CKD is on is close to 14 every day. Different medications, not that you take one medication 3 times a day, but 14 different medications. That's really hard, right? For the patients, not for me as their physician, but it's hard for the patients to live that way. And they do it. They do a great job. They thrive. It's easy for me to ask somebody to do their dialysis or come to dialysis, but I'm not the patient. They're the ones who make it happen. But if there's a way that we can ease that burden of sickness, it would make a difference for millions of people in the United States and in the world too, right? Because our research doesn't just impact US patients, it potentially impacts people all over the world. I just wanted to say thank you to the people who have funded in the past, those that are even thinking of funding. Thank you for being here. I think you've already made such a difference for a lot of people, patients, people like myself who wake up every morning and do the research that we do. Obviously we couldn't do it without you, so thank you.